Hello and welcome. This is John Dombrowski again explaining low back injections for patients. Again, the next injection I'd like to talk to you about today are lumbar facet injections. And most likely have a prescription there for some back injection, an epidural injection, or whatever the case might be. Now, is a low back injection that's a facet injection? Again, the facet joints lie right here on the side, and these are called facet joints. And we have them all up and down our spine. It allows our body to move forward, and then as we stand up, to move back like this. This is what a facet joint does. Most patients are going to present in my clinical practice with generalized low back pain. They can literally put their hand over it, or maybe two hands. And maybe that radiates down to their butt, but no lower. Now, most likely you have something on your MRI, a herniated disc or degenerative disc disease. In my clinical experience, you most also will probably have some facet arthritis or arthropathy. Since the pain does not radiate down the leg, as with a nerve root, it's only in the low back, and the majority of the patients have pain on the low back, my bet is the pain would be coming from the facets. How do we determine this? Well, get an injection. Everything, especially a facet, must be done under x-ray guidance, as mentioned in the previous video. It allows us to determine exactly where our needle is at all times to give you benefit. So again, we bring the patient to the fluoroscopy room. Again, no sedation, what is traditionally given. We clean the patient's back off with alcohol, de-sting in the small of her back. That's the local anesthetic. Once the local anesthetic has had a chance to take hold, we then place a needle, sometimes in the joint, but nowadays we do a median branch block in this level right here. And this level right here is where the nerve is that innervates that entire joint. So instead of doing a knee injection, we could essentially anesthetize the patient's knee, and they would like that too. So again, there's usually dual innervation for the patients with the low back pain. So we do one level and the level below that, because there's usually some crosstalk with respect to the innervation. If the pain is usually worse on one side, we will take care of that side first. If it's bilateral, again, it tends to be a little bit more aggressive. We can do both sides. I tend not to like to do that. I tend to like to just stick to one side and treat the worst side first. Again, this procedure can be very helpful with respect to patients with low back pain, but also it can be very diagnostic. It's going to first tell you, finally, where's your pain coming from? This is an important task, because once we determine where the pain is coming from, we can have then better therapies for you as a patient. Again, most likely you're going to need more than one injection, so we do two on the side, and then see the patient back in a week or two for follow-up, perhaps another injection at that time. If, however, the injections do work well, but the relief is short-lived, you would be an excellent candidate for what's called radiofrequency ablation. I know it's a big word, but basically it's microwave energy. We all have had experience with microwave ovens and stoves, etc. They warm things with microwave energy, with radio waves. So what you can do with this is put the needle in, through the needle is warmed with microwave energy, and this can cause the nerve to be cauterized or burned, and that can give you pain relief for approximately 3 to 4, perhaps even 6 months. Now, with radiofrequency ablation, that sounds great, but unfortunately, the nerve does grow back, and this is very common. This is the way nerves will react. Again, just like you get a haircut, a month later, you got to get another haircut. There's nothing wrong with you, the barber, or their scissors. It's just the way things go. But again, it is a way of helping patients out with chronic low back pain that nothing else has helped with. Thank you.